I'm just wondering, do you get any conversations about what's the latest now? Like there's always things are changing, and do you get into conversations with, well, we heard about this, and maybe we would like to try this, and is part of the fading or not part of the fading, or do you get into any of that? Or?
Well, we discussed what's working for her from the positive point of view. And we always try to look for new options. I work closely with Dr. Matthews. I'll call her often and speak to her. Nicole's developed this new habit at home. Minor behaviors, what can we do to move her along? That's one of the reasons that we've been able to fade her off the device where at home she's not on it anymore. And when we go on vacation, we bring it with her, but we're not allowed to use it in another state. It's with us. So when we go anywhere, we don't bring it with us. We wouldn't have reached that point if we hadn't been able to. The first thing we did was control her, stop hurting herself. 1,000 times a week is a lot to be hitting your face and pinching yourself constantly. Once we stopped that, then we're able to teach her something. Then these behavior techniques that they're advocating, the positive reinforcements, can work because you have someone who's going to pay attention and who's going to then be attuned to it. When they're hurting themselves, they don't listen to positive reinforcement. They don't listen to anything. They're going to hurt themselves or they're going to hurt you. But once you stop it and you can get them to listen, stop the behavior suddenly, then you can begin to teach them positive behaviors and the behavior and reinforce it using these other techniques and the sensory input techniques, all these different things that they try as well. But for Nicole, now these positive behaviors, you're going to go to the pool, we're going to go swimming, we're going to go for a bike ride, now work because they have become rewarding to her now. Whereas before, it was just, she ate, she slept, she hit her face, she pinched you. So, I'm all for work for positive reinforcement. Nobody wants to hurt anybody. I've tried that GED. I tried it 3 times before I allowed them to do it on her. And when she came home with it, I tried it on myself again to make sure that it was the same thing I had tried in the office, when the demonstration. And it was. And it's painful, but it got the job done, and it helped her to move away. As painful as that was, it was nowhere near as painful as those punches. Like I said, I tried to block them when she used to do them, and I couldn't. You'd have to restrain her and hold her down, and it was not an easy task. But that was her life. Punching, hitting herself, eat, sleep, go to the bathroom, punch, hit yourself, day in, day out. It's a nightmare. It's incredible to describe. Not all kids are like that. It's a very small population. And when nothing works, when you've tried everything, and these people at Mesa Center and all these schools that I described, they're experts. They're just as knowledgeable as the people that testified here. They're up to date on the state-of-the-art techniques. It didn't work for them. They tried their hardest. This worked. And I just think it would be tragic to deprive a child that doesn't fit the mode of most kids of a therapy that can work so well, so quickly, so that then you can get them moving to actually learning and then allowing them to be in a position where they can be receptive to positive reinforcement. The idea is to wean them off the adversities. They never stop coming up with new techniques or new ways of looking at Nicole and seeing what's positively reinforcing to her and trying to get her to use those. I don't even know about that reward store. I mean, I know it's there. Nicole's positive reinforcement is the daily communication with her teachers, the hugging, the high fives, the achievement. Anyway, I feel like I'm going ahead. Thank you.
Thank you. Just one quick question. When the aversives are being used, how do you know it's an appropriate situation when it's being used? I understand there's cameras at JRC, and they've got. Can you actually? Did somebody tell me that you can watch your child's proceedings during the course of the day?
Yeah.
Plug into something. Is that correct?
Yeah.
If
you go to the school, you can watch the tape from the last, 24, 48 hours, something like that.
So that's how you follow up if it's appropriate? 48 hours later?
No, I've never watched the tape of past, but any parent can anytime. But it's in his plans, in his service plan, what is going to be used and how it's going to be done. It's all in the service plan.
I talk to my daughter's clinician every day, and if she's had a GED, which as I told you, she hasn't had many in the last 4 months, and find out what it's, the clinician finds out what that was for and makes sure that it's appropriate.
You have the consultation with the clinicians.
I do. I talk to her every day.
My wife always asks her, did you get a GED? And she'll say yes. If she didn't, she'll say no. But whenever it says on that paper that she got one and you ask her, she'll tell you she did. Again, it hardly ever happens anymore. It's been months. But then we'll call and find out what precipitated it, what happened, why did they do it, and so forth. But there's a room with tapes, and they're constantly monitored, and they have to have two people have to say they saw the behavior, confirm it with the other clinician before they can apply the GED. It's not just one person saying, "Oh, I'll give you the GED." Thank you.
Thank you.
Thank you.